Hello everyone, I am Dr. Kavita Gajbhie, Assistant Professor in Pune College of Pharmacy. Today I am going to deliver the lecture on tumor targeted drug delivery system. So before starting, what is actually tumor targeted drug delivery system? It is very necessary to know what is the cancer or tumor condition. So we can say cancer is a disease in which cell division is uncontrolled and spread within the body of the abnormal form from body's own cells. And tumor may be classified into two categories: benign tumor, which is non-cancerous in nature because it cannot be spread from one area to another area of the body, and the another condition which is known as the malignant tumor, which is carcinogenic in nature and metastatic in nature because it can locate from one area to another side of the body and spread all over the body. So here you can see the aggressive tumor cells which is present in a unwanted or uncontrollable growth of the tissues or cells occurs, and normal blood cells you can also see, and metastatic spread of the cells you can see throughout the blood vessels. So what is the difference between the normal cell and cancer cell? So here we can see the normal cell, it has the normal vasculature, lymphatic drainage developed and normal pH condition. But in case of tumorous condition, the leaky vasculature occurs, impaired lymphatic drainage occurs and low intracellular pH. Generally the acidic pH condition, it develops in case of tumor condition and whole microenvironment of the cell must be acidic in case of cancer. And also here in case of normal cells, fine chromatin, single nucleus and single nucleolus present, and just opposite in case of cancer cell, the coarse chromatin, multiple nuclei and multiple nucleoli are present. So what is actually tumor targeting? So tumor targeting, we can say that specific interaction between the drug and its receptor at the molecular level, which is known as the tumor targeting. A rapidly growing tumor requires various kinds of nutrients and vitamins. Therefore, tumor cells overexpress many tumor-specific receptors for fulfilling all the requirement of the tumor cell, which can be used as a targets to deliver the cytotoxic agent into the tumor, inside the microenvironment of the tumor. So here for tumor targeting, we can say the targeted therapy or targeted drug delivery system combinedly we can use for more effective delivery of the cytotoxic agent inside the tumorous cell. So here, first of all, we should know what is the targeted therapy and what is the meaning of targeted drug delivery. So here, targeted therapy, it is a type of medication that blocks the growth of cancer cells by interfering with specific targets which are needed for carcinogenesis and tumor growth. And here, the targeted drug delivery refers to predominant drug accumulation within a target zone that is independent of the method and route of administration. So basically some kind of ligands which is used for targeting the carrier system which can deliver the drug at the desired area for a desired site, at a desired site. So here, the advantages of targeted drug delivery system, if we see, so it's a morphology and physiological difference between the normal cell and tumor cell, which is very important for delivering the drug to the target site. An ideal anti-cancer drug delivery system should fulfill following requirements like effectively kill tumor cells, be non-toxic for other healthy tissues, organs, and cells, and not induce multi-drug resistance. So drug targeting to tumor is based on the enhanced permeability and retention effect. This is very, very important phenomena And another important thing is that specific kind of carrier system. For example, nanoparticle, it has best property to deliver the cytotoxic drug because of its nature and its multifunctional properties. And also another phenomena is the ligand receptor interaction. It must be very, very efficient. After that, we can say the efficient interaction is possible to deliver the drug to the depth of the microenvironment in a higher proportion. So effective drug delivery system, it gives the proper retention of the drug, proper release of the drug, proper targeting of the drug with evading of the drug, proper evading. What are the molecular targets for tumor therapy? So here few targets are present like altered expression of cell adhesion molecules, altered expressions of a receptor during certain stage of cellular differentiation like transferrin receptors and folate receptors, and lots of receptors are present. Altered expression of certain growth factors like epidermal growth factor receptor, expression of tumor vasculature epitopes, expression of surface determinants on malignant cells like tumor associated genes. Now the principle of tumor targeting. What is the principle of tumor targeting? So here we can say tumor targeting principle involves targeting of drug by using some specific strategies like passive targeting, like active targeting to cancer cell, and also the active targeting to endothelial cells, triggered drug delivery by using some kind of smart and stimuli responsive carrier materials. So site-specific drug delivery requires localization of drug and carriers within the desired target organ. The role of carrier system in providing the site specificity can be evident from the term passive and active approaches. So if we see what is the passive targeting strategy, it involves the therapeutic exploitation of the natural distribution pattern of a drug carrier construct. And for example, we can say the RES in clearing foreign particulate material from blood permits drug encapsulation in particulate carrier like liposome to be passively targeted to the macrophages. And it is based on the drug accumulation in the areas around the tumor with leaky vasculature and commonly referred as the enhanced permeability or enhanced permission and retention effect, which is shortly known as the EPR effect. So what is EPR effect? EPR retention, it provides the proper condition or proper environment for entry of cytotoxic drug through the carrier system because it serves as a leaky vasculature, impaired lymphatic drainage, renal clearance, and reticuloendothelial system uptake. So you can see here in the tumorous condition, vasculature must be leaky. So nanocarrier system can be easily penetrate or easily enter inside the tumorous cell for more accumulation and retention of the drug in a desired microenvironment as compared to the other area of the blood vessels. The classification of tumor targeted drug delivery. So here basically classified on the basis of some kind of system or some kind of carrier systems used for the delivery of the anti-cancer drugs. So here macromolecular conjugate or particulate system useful. So in case of macromolecular conjugate, we can say polymer drug conjugate, protein drug conjugate, antibody drug conjugate, and particulate system involves liposomes, pegylated liposomes, polymeric micelles. So these are the few examples of some carrier systems. Over the surface, various type of linkers are available, which is useful for attachment of a specific kind of ligand, which would be useful for proper attachment with the receptor moieties. Now some approved passive tumor targeted drug delivery system which is available in the market. So we can say the nanoparticles loaded with the doxorubicin, which is known as the transdrug and useful for the hepatocarcinoma. Doxorubicin loaded liposomes, myocell is the brand name, and it is useful for treatment of breast cancer. And the pegylated doxorubicin nanocarrier system, which is known as the Doxil and useful for the treatment of ovarian cancer. Some active targeting, yes, active targeting to cancer cell. Now, what is the active targeting? Because basically passive and active targeting is very useful. So active targeting is used to describe a specific interaction between the drug carrier and the target cell, usually through a specific ligand receptor interaction. And simply it means a specific ligand receptor type of interaction for intracellular localization, which occurs only after blood circulation and extravasation. So it improves the target cell recognition and the target cell uptake, and also improve overall tumor accumulation. So ligand-mediated targeting is the major focus of the current research that involve ligand developed against a cell, receptor, or antigenic determinant expressed on tumor cells or vasculature. So basically, active targeting depends on the drug carrier system, and a specific kind of targeting moiety over there, which would be useful for proper interaction and localization of the drug. So here few elements like drug, ligand, drug carrier, and release trigger useful for the formulation or preparation of active targeted drug delivery system. Now few examples of active targeting moieties. So here monoclonal antibodies is the best example, and also transferrin, some kind of most exploited targets for antibody targeting are the transferrin receptors, and it is highly overexpressed in case of glioma cells. Fibronectin in case of angiogenesis, epidermal growth factor receptor in case of solid tumor or breast cancer, vascular endothelial growth receptors, growth factor expressed in neoplastic blood vessels. Some immunoconjugates combine the targeting power of monoclonal antibodies and cytotoxic activity of the drug, for example, radioactive substances or some specific potent drugs. Vitamins as an active targeting moiety also useful. So the folate receptor is significantly upregulated on many cancer cells compared to normal cell. Normal cell transport are reduced folate across their membrane but will not transport folate conjugate of any type. And also the malignant cell transport folate conjugate through the folate receptor, which is considered the alternative route. So lots of examples are there for active, which shows the active targeting of the moiety. Now the active targeting to vasculature. What is actually this? Actually, in case of tumor vasculature targeted nanomedicine, which do not depend on the extravasation and penetration across the pericyte, smooth muscle cell, and the fibroblast-based cell layers. And as they encounter their target receptors much more frequently, and since they do not suffer from the high tumor cell density and high interstitial fluid pressure, that unfavorably affect cancer cell targeting nanomedicines. And thus the endothelial cell targeted nanomedicine poses significantly more potential for improving anti-tumor efficacy. So after that, I am coming what is actually the triggered drug delivery system. Triggered drug delivery system, it is a kind of system by using some specific kind of stimuli responsive polymers or material, we can trigger the delivery or release of drug at a specific site, at a specific area. So that can be done by using some external stimulus also, or maybe some internal stimulus. In this condition we can utilize, for example, thermosensitive liposomes, destabilization of lipid membrane, at mild hyperthermia. And these drug carrier construct that release the drug only when exposed to specific microenvironment. For example, in case of changing the pH, in case of changing the that acidic or alkaline or neutral condition of that particular area, or maybe changing the temperature in that area, or release of any biological fluid, release of any enzyme. So that type of trigger drug delivery also would be possible in case of formulation of smart or stimuli responsive carrier system. So here you can see stimulus we can generate by the thermal, electronic, light, magnetic, ultrasound, hypoxia, pH, redox, ATP, or enzyme. So that control drug release and the drug prop ligand activation confirmation changes conversation occurs by using that type of stimulus. So here few examples like thermodox, so temperature sensitive pegylated liposomes containing doxorubicin, and also tamoxifen loaded iron poly lactic acid nanoparticle, which is useful for breast cancer targeting. So what is the conclusion of this tumor targeted drug delivery system? So we can say why this can be achieved through passive and active targeting. It is a kind of approach that we can achieve by passive or active targeting of the drug. And several systems have been demonstrated excellent tumor targeting properties such as macromolecular conjugate, liposome, polymeric micelles. Anti-cancer drugs with specific physicochemical properties are delivered by these drug delivery system, and a number of targeting ligands were successfully incorporated to enhance the tumor-specific targeting. An optimal tumor-targeted delivery system shall be realized in the near future. So all these are the reference. Thank you so much.